Okay guys, this segment is just for you. If you are running to the restroom, having pain, urinating, or an enlarged prostate, there is some help out there. Dr. Daniel Jaffee with Affiliated Urologists is here this morning to tell us about a procedure that can help you feel and live normal again. Good to have you back with us.
Thank you for having me.
So what is an enlarged prostate? How does that occur?
So an enlarged prostate happens very commonly starting at the age of 40. This gland that starts out about the size of a walnut right next to the bladder starts to grow. And the urine has to pass right through this gland. So kind of like if you envision a donut frying, the whole donut gets bigger, but the hole in the middle is getting smaller.
Oh, that's a great analogy.
That's blocking the flow of urine.
All right, so this is what we're looking at right here. So how does an enlarged prostate impact a man's daily life?
The impact can start slowly and can be an increase in the amount of trips to the bathroom, but more importantly, it can interfere with their sleep. So they can wake up throughout the night, and what we now know is, and I've seen this in my practice, but studies prove it, this doesn't impact just men, this impacts their wives. Yeah. And so it can really have a negative effect at your ability to sit through a movie, of your ability to sit through work, because you're constantly running to the bathroom.
And sleep through the night, you're waking up your spouse. Absolutely. What happens if left untreated? What are the risks of that?
So a prostate causing a blockage to the bladder over time makes the bladder damaged. And so the bladder becomes thicker, the wall of the bladder is less able to stretch. So instead of being able to hold more and more comfortably, it starts to stretch and gives you these strong signals to run to the bathroom way earlier.
And a lot of men may treat this with medication. Is there any danger in that?
Medicines can have a lot of symptom relief for a period of time, but they also can have side effects. And they don't correct that underlying problem. So the bladder may be continuing to become damaged like that.
And you offer a treatment, really revolutionary. It's called the UroLift.
Yeah.
How is that different?
The
We're going
UroLift
to see an image, an animation of this right now. How is this different?
This has changed the whole approach for me because this is a non-surgical treatment. We're not damaging any of the tissue. We're not impacting any of the sexual function or urinary function with this treatment. And it's something that we can introduce earlier because it's so well tolerated.
So this is a non-surgical treatment. It's all done in clinic. What is the recovery like? Will men be instantly cured? How does that happen?
There's as expected, going to be a recovery for everything. So the first few days, there's going to be some blood, there's going to be some burning, and there may be some degree of discomfort. That goes away very quickly compared to other treatments that are available. And the beauty of this is, compared to other treatments, it has no lasting negative effect.
Right. You were even saying sexual function isn't impacted. This is the only treatment that
does that.
This is the only
one that can say that.
All right. So, I find this really important for our viewers to understand. You are designated a UroLift Center of Excellence. Yes. Congratulations on that.
Thank you. It was a great honor.
What does that mean?
It means that because I have done the volume that I've done, I've had extra training as well as my staff has had extra training. And the company has looked very closely at outcomes, and they've seen that we have the volume and the excellent outcomes to name us one of 60 across the country where there are over 10,000 urologists practicing. So I was really honored by that.
How many have you done? How many of these UroLifts?
Hundreds.
Hundreds of UroLifts. It's changed the game for you because now you can go to these men with a new option. How has that changed your treatment?
Right, so a lot of people don't want to take pills at all. And so when the only option outside of medicine was a treatment that could possibly have a lasting negative effect, I would say, well, stay on the medicine longer because we don't want to do anything that could cause any harm. Now I have an option where I know I can do a treatment which will not have any of those negative outcomes, even that some of the medicines cause.
Wow.
So this could even have a lower risk than medicines themselves.
And a stamp of approval of excellence. Congratulations to you. Great information. Affiliated Urologists, there are 3 Valley locations for your convenience. The main office is located at 5133 North Central Avenue in Phoenix. Call 602-737-2806 or visit affiliatedurologists.com to book an appointment.